So I think this question is really asking, what is the study that all of us have been reading now about the Pfizer vaccine? How did it work and what did it show, right? Is this an effective vaccine? That's the question. So the study that Pfizer just published was a randomized controlled trial with two different arms. What that means is they took a whole bunch of people, 22,000 in each group, and randomly assigned these folks to either get a jab of placebo, which was salt water in the arm, or to get a jab of the true COVID vaccine in the arm. And the people administering the vaccine didn't know which was which, and the people looking at the data and the results didn't know who was who. That's what double-blinded means. Nobody knows who got the actual true vaccine and who got the placebo of the salt water in the arm. There are two doses to this particular vaccine. So 21 days later, a next round of placebo versus vaccine was given one more time. And then folks essentially waited to see, of these 44,000 people, how many folks went on to develop symptomatic COVID, right? So of that population of 44,000 folks or so, 170 people developed COVID-19. So at that point, once the researchers saw, okay, we've got this now population who had COVID, let's go back and look what proportion of those people got the placebo and what proportion of those people got the vaccine. So of the 170 people that came down with COVID, 162 of those people, so the vast majority, actually got the placebo or no vaccine. Of that small piece, that 162 of them, 9 of those people had what we would consider severe infection. Compare that to a grand total of 8 of those 170 people who got COVID, 8 of those received the vaccine, and of those 8, only 1 developed severe infection. So if you do the math and the percentages there, that's where you're hearing the data that says that means the COVID vaccine was somewhere between 90 and 95% effective in reducing COVID-19 infections. Purely based upon that. It's not rocket science.
It's vaccine science.
It's vaccine science.
Yeah, I think if there's anything that you can feel secure about, it's the efficacy of this vaccine. I mean, the data is really outstanding on how well it works to prevent COVID disease. And actually, I think there's some data that's come out now that even after a single dose of the vaccine, there's still like a reduction of greater than 50%, which is pretty pretty amazing.